interesting topic, we need to see the shock part in the C before going to the neuro disability. In this order, third, we look at the circulatory status. In every trauma scenario, there is a volume loss that needs to be replenished, especially in a fracture. Thus, we recommend 2 large bore IV following by a whole blood, either O positive or the patient's blood group. Hemorrhage is a predominant cause of preventable deaths after injury. Hypotension following injury may be considered to be hypovolemic in origin until proven otherwise. The elements of clinical observation that yield important information within seconds are level of consciousness, skin color, and pulse. Cerebral perfusion may be critically impaired, resulting in altered level of consciousness. And a patient with pink skin, especially in the face and extremities. A rapid thready pulse is typically a sign of hypovolemia. External or internal, it may be either external hemorrhage is identified and controlled during the primary survey. Rapid external blood loss is managed by direct manual pressure on the wound. Tourniquets are effective in massive exsanguination from the extremity, but they carry a risk of ischemic injury to the extremity and should be only used when direct pressure is not effective. Pitfalls are the special population groups, elderly, children, athletes, individuals with chronic medical conditions. They do not respond to volume loss in a similar manner or even in a normal manner. In elderly patients, blood pressure has little correlation with cardiac output. In older patients, anticoagulation therapy for medical conditions such as atrial fibrillation, coronary artery disease, and transient ischemic attacks can increase the blood loss. Children usually have abundant physiological reserve and often have few signs of hypovolemia even after severe blood loss depletion. Often the ample history is not available or is taken for granted, and so the healthcare team is not aware of the patient's use of medications for chronic conditions. In the D, that is my disability portion, I take a look again at the level of consciousness as per my GCS scoring, and if it is improving or worsening, I score it by the sum total of eye, verbal or motor responses. A decrease in the level of consciousness may indicate decreased cerebral oxygenation and or perfusion, or it may be caused by direct cerebral injury. Hypoglycemia and alcohol, narcotics and other drugs can also alter the patient's level of consciousness. Prevention of secondary brain injury by maintaining adequate oxygenation and perfusion are the main goals of initial management. During the exposure, we cut the clothes of the patient to thoroughly assess the patient for seeing any signs that may signify bleeding elsewhere. However, we do a detailed examination from head to toe in the secondary survey. And during the primary survey, it is important to see for anything that may lead to the patient's death during the resuscitation. After adequately exposing the patient, it is equally important to cover him up with a dressing on the wound or by warm blankets to prevent hypothermia. Intravenous fluids should be warmed before infusion. Neurological deterioration can occur often rapidly, and the lucid interval classically associated with acute epidural hematoma is an example of a situation in which the patient will talk and die. F stands for FAST exam, that is the focused assessment sonography in trauma. And it is an adjunct to primary resuscitation in which we first check for the heart, then the liver, spleen, kidney or bladder injury with an ultrasound device. An evidence of hemorrhage found during this exsanguination should be either further investigated or surgically explored. Remember that the first hour of resuscitation is golden and much can be done by being aware of what we are dealing with. G stands for glucose testing. Patient may either be hypoglycemic or may have a raised blood sugar because of stress, or he may even be diabetic. It is crucial to resuscitate it primarily. In a case of a patient being a female, one needs to see if she is pregnant. Any pregnancy above 20 weeks becomes significant. Next, we hang IV antibiotics, which stand for H. Infection is in early trauma scenarios may have shown to increase morbidity. Lastly, we give I, that is injection tetanus, for any suspected open injury as to prevent the patient from sustaining a life-threatening condition. In the next section, we would cover the actual resuscitation. If you have any queries, insights, or experiences, please feel free to write in the section below. Thanks for watching.